Lori Collins is an emergency medicine physician's assistant at Chelsea Hospital, and specifically in the emergency department and urgent care. A very nice, calming place while you're waiting to be seen.
Mm-hmm.
And how do you decide when you walk in whether you are to go to urgent care or the emergency department?
Yeah. So I think we've recognized that with our volume of 20,000 plus patients, that in those patient mix, there's a population that has minor needs, meaning they require less resources. Like if you fall, you injure your ankle, you sprain your wrist, simple lacerations, those are equipped for just kind of minor resources in urgent care. And so we have a list of those type of patients that's at our front desk. And so we're able to delineate those urgent care versus emergency. So non-life-threatening minor things.
And sometimes you can't tell just from looking at someone.
True. And so that distinction happens once they're seen by a provider or once they're in the triage area. Maybe they have unstable vital signs. Their blood pressure is really high, their heart rate's really high. And then at that point, the provider or the RN can upgrade that patient to a more acute needs or an emergency room department.
So the patient really doesn't have to make a decision.
Absolutely. It's kind of thinkless. They don't have to worry about, making the decision to go to an urgent care and then being transferred by ambulance to the emergency room. We kind of make that decision for them.
And I think there are situations where people are at home, they have the emergency, and they think to themselves, should I go in or should I wait and talk to my doctor tomorrow? Should people go in if they're not sure?
I absolutely think so, because there may be something underlying that can't wait the next day. And again, we can help make that distinction, like chest pain, abdominal pain. There may be some more hidden emergency things that need to be addressed more immediate than waiting the next day.
Is time urgency the biggest factor?
Absolutely. I would say it depends on the chief complaint, especially when like chest pain, in an elderly patient. I don't think that's something that should stay at home and wait.
All right.
So I do think it depends on the patient population, the age, and what the chief complaint is.
What types of injuries or illnesses or situations are you triaging to urgent care?
Specifically patients that come in with stable vital signs, and when I say stable vital signs, the blood pressure looks good, the heart rate looks good, and they come in with cold-like symptoms. They have a sore throat, they have a minor laceration that needs stitches. They may fall, they may injure their ankle, and those are pretty suitable for our urgent care needs, meaning minimal resources.
I understand there are people who might not have a primary physician that end up here as their main source of health care.
Mm-hmm. Yeah.
And those are urgent care situations, I would imagine, as well.
That's a good point. They truly are. And I think we're seeing a lot of that because primary care physician offices, they may not have one or they can't get in a suitable amount of time. So I do think that makes up some majority of our urgent care patients that we're happy to see as well in the urgent care.
It's so unusual to have urgent care located in an emergency department. Is that unique to Chelsea Hospital?
It is very unique to Chelsea and probably one of the first you'll see probably in the state of Michigan. We thought that it would address the needs of our community. We just thought it was something that needed to be done. And so since our launch of February 2nd, we've definitely seen that volume increasing. Mm-hmm. So we do think that we've been able to kind of meet the needs of our community. It's reliable in terms of its location. We're accountable in terms of having providers that are ER trained, who can also take care of urgent care needs.
And I don't think there's anyone that wants to go to the emergency department, but does it become more likely then that someone's willing to come in to be seen, knowing that, well, it's urgent care, but if it's really bad, they've got the emergency department there?
Exactly, and I think that's kind of the novel thing about it, is knowing that you come to a facility where ER and urgent care is under one roof, and knowing that if I'm not urgent care, I don't have to be transferred by ambulance and incur another cost. So I think that the patient population will appreciate that.
And have you had patients that thought, oh, I'm definitely an urgent care patient, I'm not gonna drop dead in the next 10 minutes, but that you discover that, yes, actually you are an emergency patient.
Yeah, and I do think that takes a little bit of educating the patient about why we made the decision that we did. And I think with a little bit of education, they understand that. that yes, your complaint requires more than one resource, meaning you need pain medication, you need an ultrasound, you need a CAT scan. And then I think once you educate them, they're understanding of that upgrade.
And you have all of those diagnostic tools right here.
We do. It's all under one roof where we don't have to send them out, and it's just done and it's seamless. And within a few hours, hopefully their length of stay is a little bit shorter because they don't have to also add into that transfer time, or even being at their PCP's office who may send them to urgent care, and then urgent care may send them to ER. So it does save a lot of steps.
Well, what's interesting and I think noticeable right off the bat, Lori, is we're in a waiting room that is sectioned and there's no one in it. What does that mean?
It probably means that they're all been triaged and back into the rooms. And I think we have excellent triage RNs and our nursing leadership, like our RNs who are able to get patients back to rooms quickly. And it's very hard to determine what our volume will be like. I mean, we have volume surges that happen early in the morning and even in the evening.
Yeah, we're here midday on a work day. What is the busy time for
Mondays.
Mondays.
Mondays traditionally is the busiest day in the ER urgent care because people don't want to use those weekends to sit in the ER, to sit in an urgent care. So Mondays traditionally is our highest volume.
Yeah, okay, so they'll I guess, deal with it for the weekend and then come in on Monday. What about time of day?
So Monday, probably early afternoon and after work, like that evening surge we get. That's probably one of our busiest times.
And what are the typical issues people are coming into the urgent care or emergency department for?
I would say urgent care would be like kids falling, lacerations, ankle sprains, sore throat, COVID still. And then in terms of emergency, we're getting the chest pain, we have abdominal pain, we may have headaches, stroke, we may have traumas, you know, when you look at the opposite spectrum in terms of our emergency needs. But yes, we get the life-threatening and non-threatening things that come to the department.
And do men and women both ignore chest pains?
Women more so than men as well, I would say, traditionally.
Wow.
I think women tend to be a little bit stoic and try to kind of downplay those complaints. But I think that's probably the biggest population that downplays it.
Amazing. The profession sounds like it's got a lot of excitement to it. What got you interested in emergency medicine?
You know, I probably since high school knew that I wanted to be in medicine because I just, I don't know, I've always cared about patient care, and it was an interest that I've had very early on. I found out about being a PA when I initially started out being a college basketball coach, and I knew I wanted to still go into medicine. So I found out about like being a PA 20 plus years ago, and I applied and I got into the first school I applied to, and I have not looked back. So I really enjoyed the profession, the career. It's a wonderful profession.
Great. Well, it's nice to see you here, not professionally, and thanks for your time.
Thank you so much.
Emergency medicine physician's assistant Lori Collins here at Chelsea Hospital, urgent care and emergency department.